Hello, good afternoon. It's Alexa here with Kelowna Now. I am getting to sit down with Rutland Medical Pharmacy to talk about something that is very interesting, and I don't know that much about it, but I feel like most Canadians, most Kelowna people, BC is very gray, and you kind of we're in that hibernation like time of year where you're feeling very tired, maybe a little bit depressed. There's not a lot of light in our day. And we're still in our cold season. So Steven's here to talk about seasonal affective disorder.
Yes,
And can you explain even just like the basics of what that is?
sure. Yeah, seasonal affective disorder for most people is something that is likely to come on in kind of mid to late fall, going into winter. It's for most people goes away during the sunnier months of spring and summer. In rare cases, it can be the opposite. Maybe we can briefly talk about that later, but it's just something that occurs. It's a mental health related condition that occurs due to the change usually in the sunlight hours. So as we get less sunlight, it gets grayer out, which in the Okanagan we can get really socked in the fall and winter. So without that sun, people often go through a period of feeling extra down, feeling sad, all kinds of symptoms from listlessness. Sometimes people have more cravings for carbohydrates and you encounter weight gain. There can be problems sleeping, feelings of sluggish, and certainly depression, and in more extreme cases, feeling worthless, and there can be an increase in feelings of thinking about suicide in
Mm.
really extreme cases.
Very crazy that we're affected so much by light, but it totally makes sense.
Hmm.
Is there things that you at the pharmacy can help treat someone that is maybe on this more severe, like maybe we can talk about the very severe case
Sure.
and then just maybe try out, I don't know, if, is there vitamins we should be taking, do you think? Or,
There are some options there. If someone's having severe symptoms of seasonal affective disorder, the symptoms, as I mentioned, will usually manifest very similar to depression, and in fact, there will be depression. The cause is just the seasonal affective disorder itself, usually. So for something like that, people should be seeing a doctor who can prescribe potentially an antidepressant or which is and can be an effective treatment, a counselor. There's many different options that good counselors can help with, from psychotherapy, cognitive behavioral therapy, where you try to help people to learn techniques to sort of change their thought process instead of going down that thought process path of unhealthy mental health. They train people to try to recognize those thoughts and sort of pivot the thoughts to a more healthy thought process. It's not always as easy
mm-hmm.
as saying that, absolutely. Um, but so people usually would be seeking out other medical professionals other than just us at the pharmacy. We're happy at Rutland Medical Pharmacy to try to help you get to those resources. If it came to wanting a supplement, wanting to just talk about it, we're there for that. We certainly will give you the time for that and try to support you. And of course, if a doctor or a prescriber that can prescribe and can treat you for that feels that an antidepressant is needed, which, as I mentioned, can be very helpful. We're certainly there for you for that and can tell you all about those options too.
Do you, and you might not know the answer, which is totally fine because we actually found out some new stuff today that I'm
Yeah,
excited for you to tell people because I don't think most people know about it. But do you think this targets a certain like gender like or is it everyone that really truly is affected or is do you know if there's any data that it's like younger people, older people? Like is there any information or did you read anything on this?
no, I did do a little bit of extra reading to
Yeah.
make sure I wasn't missing anything, and certainly I don't know everything.
Yeah.
Uh, it from what I understand and what I read, it affects everyone:
Hmm.
men, women, children, older
Oh,
people, younger
children.
people.
Never even thought about
Yeah,
kids.
it can affect everybody.
You just assume kids are happy all the time.
Yeah, no, it's very easy to
Yeah.
assume that.
Yeah.
From a general mental health perspective,
Mm-hmm.
kids and teenagers experience mental health struggles as well. Um, I mean, sometimes different mental health struggles can occur in different amounts in adults versus children, but it can occur in everybody. And what we see is a fluctuation in serotonin. There's a neurotransmitter or chemical in our bodies that our brains naturally produce called serotonin. When we are experiencing seasonal affective disorder and potentially other mental health
Mm-hmm.
conditions too, like depression and anxiety, we see a decreased effect, or really decreased activity, I should say, of serotonin in the brain, in the synapses in between the neurons in the brain. And so when we see that decreased serotonin, we're more likely to feel symptoms of depression and anxiety, which is what comes along with seasonal
Mm-hmm.
affective disorder. Now,
Yeah.
our body produces serotonin naturally, but when there's less sun and we're exposed to fewer daylight hours, our body is more likely to not produce and have as much serotonin effect, which is
Mm-hmm.
how that's linked to seasonal affective disorder.
Do you think that, like, let's say someone gets sad during the winter, but like, how, is there a comparison you can make, or is depression totally different from sad, or is it like a type of depression, or like it kind of like when you
Sad as in
start,
seasonal
yeah,
affective disorder, or
yeah,
feeling sad?
yeah, like it's
I,
just,
that's what I wanted to make sure which one, because we refer to seasonal affective disorder as SAD, right? It's an
yeah,
abbreviation, but um, you can also feel sad, two
yeah,
separate things.
totally.
Um, but depression would more be a symptom of seasonal affective
Okay,
disorder or SAD. Um, you can also feel sad, but just because you feel sad doesn't mean
and
you're
you're
depressed. It
depressed.
would be more of a chronic
Mm.
health condition that you're experiencing where you're you can't shake it. I mean, everyone gets sad. It's normal to
It's a
get,
normal
and let me
emotion.
say,
Yeah,
sad as an
yeah,
emotion, not seasonal
yeah.
affective
I guess
disorder
you have to be
sad.
correct on that.
Everyone gets the feeling of sadness from time to time. It's normal. If you're doing really well with your mental
Mm-hmm.
health, you move on, you get past it, and you're feeling down, you're feeling sad for a normal period of time. When your mental health isn't as good, and maybe you're suffering from seasonal affective
Mm-hmm.
disorder, or you're suffering from depression or something else, you're just unable to bounce back in a
Mm-hmm.
reasonable amount of time. So you're more likely with depression and seasonal affective disorder to um, and to make sure I
Yeah,
don't miss, I'm going to read some
yeah,
symptoms off a list,
yeah.
but feel listless, feel down
Mm-hmm.
nearly all the time, losing interest in activities that you would normally really enjoy doing. You could be having problems sleeping. I mentioned experiencing carbohydrate
Mm-hmm.
cravings and experiencing weight gain, feelings of hopelessness, worthlessness, more guilty,
Mm.
having difficult concentrating. Things like that are occurring, and you can't change those thought
Yeah.
processes. You're unable to look at these things and say, if there's not a normal reason for it,
Yeah.
maybe it's not, why am I feeling this way? I shouldn't feel this way, but you can't sort of get past that and get back to a feeling
Hope.
of hope and
Well, I think it's like
feeling
that
good.
extreme, like if you're going days, months, like if you
Hmm.
you should be able to get yourself out of it not fast. Like sometimes maybe something's going on in your life, it takes time, but I
Absolutely.
think if you're in that every day, you like don't want to
Yeah.
move, get up, eat even, like something's going on.
Yeah, and that's where it's important that we seek help. We don't just say to ourselves, something's wrong with me. Why can't I deal with this? So when you're feeling something like that and going through something like that all the time, day in and day out, it's time to see a doctor or a
Hmm.
clinical counselor or someone, talk about getting help. I mean, you mentioned supplements. As a pharmacist,
Yeah.
our scope is limited. We can't prescribe for things like
Yeah.
this if you haven't consulted with a doctor and received a prescription. But we can certainly talk about things. And um, although the evidence is more limited and doesn't there's nothing to say for sure taking supplements will
Mm-hmm.
help with these things. There's some evidence. Vitamin D is something that
Yeah.
also our vitamin D levels tend to be low in the winter.
Yeah.
Our body produces vitamin D naturally due to sun exposure in the skin. And they find that people who are suffering from seasonal affective disorder
They're
tend to have
low.
low vitamin D levels.
Mm.
There's some belief, and even you can see it on the Mayo Clinic site, that vitamin D may be involved with the production of serotonin in the
Mm-hmm.
body. Not something that there's concrete evidence
Yeah.
on, but there's some cases where supplementing vitamin D to a
Mm.
safe level, and that's
Yeah.
where you
Yeah.
want to talk to a pharmacist. You don't want to take a handful of anything,
You're
even if
just
it's a
like, get
vitamin.
better. Yeah.
Yeah. But so you can always come and talk to us, and we can talk about safe levels, and sometimes there's a
Mm-hmm.
benefit, and it can help your
Yeah.
symptoms. Sometimes not, but if it helps some of the time, and if
Yeah.
we can help you take it safely,
Yeah.
then it could be worthwhile.
Well, what's nice about having you guys right there, and like I've mentioned in other episodes, is I don't think people realize how much their pharmacist is part of like a resource, especially with the hospital and the clinics. If you've gone to the hospital lately or you've gone to try a walk-in clinic and stuff, it is long hours. You might not get
Yeah.
seen. Like, I mean, your pharmacy, and especially Rutland Medical, they're all about relationships, and you're really there as their, like, your outlet to your health and resources. And I mean, you guys are in this space, you know it. You can help guide us or guide someone maybe avoiding a long, and helping our nurses. It doesn't mean like if there's a 911
Yeah.
situation or like an emergency, yeah, you guys are not able to take care of it. But
No.
if you have some of these minor like issues going on, you guys are there to support.
Yeah. No, we're not certainly not there to try to overstep our expertise or take on someone else's expertise, but we're definitely there to be in the people business. I've said it before. I think that um, pharmacy to me is the people business. We're in the business of helping people and making people feel better. Yes, it's healthcare, but it's more about people. Everything
Mm-hmm.
we do, and so we always make sure at Rutland Medical Pharmacy that we have time for
Yeah.
our clients and any clients that come in, whether it's they're people that have been coming to us for a long time or whether you're new. We're there to help, and if it's something we don't have, that's okay. We'll do our best to direct you to a place that does
Mm-hmm.
have it. Um, yeah, and that goes with things like seasonal affective
Mm-hmm.
disorder. I mean, a perfect example. I don't carry the lamps that
Yeah.
people use. Um, could order something like that in for you, but if you come in and we talk to you and you think that it would be beneficial to you to get a sad lamp,
Yeah.
I'll help you know where to go to get it,
Yeah.
which is another thing, the non-medication treatment, that there's reasonable evidence that
Yeah.
a sad lamp, which is a special lamp that
Light.
has a very intense light, they measure the light intensity
Mm-hmm.
in something called luxes, and if you can get a sad lamp with an intensity of at least 10,000 luxes and kind of sit there, usually right when you get up in the morning,
Yeah.
because that's when you're done sleeping, you want to get into the light and make a difference to how you feel. They say if you can sit for 30 minutes under
Mm-hmm.
one of these sad lamps in the morning and do it every day,
Yeah.
it really makes a
Helps the
difference. And
mood.
there's clinical evidence
Mm.
on these that
Yeah.
it does make a big difference for many people.
Mm-hmm. Especially because a lot of us are waking up to the dark.
Yeah, yeah. The days are slowly
Yeah.
getting
Or
slowly
or
getting
getting there.
longer now. We're getting there, but if you're working a long day off, and it's tough getting up in the dark,
Yeah.
going getting home in the dark,
Yeah.
and that's what helps to contribute
Mm-hmm.
to or weighs on you and contributes to these unhealthy mental health
Mm-hmm.
conditions that can occur more in the winter.
Or just might get more
Yeah,
intense each
yeah,
season. Okay, so here we are thinking that this is a winter thing. We have been told, I mean, I've been told this is seasonal just for winter. But Stephen came to me and said, I found out some information.
yes.
So talk to me. This is also happening in spring and summertime?
To a small percentage of people, but this was something new to me. I thought I'm gonna just go over a couple of things, make sure I'm not missing something if I'm coming to
Yeah.
talk about this. And I came across what's referred to as spring and summer seasonal affective disorder. So symptoms for the spring and summer seasonal affective disorder, sometimes called summer depression, they refer to it
Mm.
as. People are more likely to experience trouble sleeping, so
Mm.
insomnia, poor appetite, weight
Mm.
loss, agitation or anxiety, increased irritability.
Mm.
You would see this more commonly in places like the far north in the
Mm.
summer, where it's light all the time. Total opposite, of course, of the winter.
Yeah.
They have much more extremes. You know, in the winter, in a place like Whitehorse,
Mm.
you hardly have any light. In the
Yeah.
middle of summer, you hardly have any dark.
Yeah,
And
extremes.
those extremes in both sides can cause a form of seasonal
Mm.
affective disorder. And I mean, part of the problem in the winter is that people's bodies just can't adjust. So your natural circadian rhythm can't adjust,
Mm.
which results in the insomnia that I
Yeah.
mentioned, the inability to sleep, which can definitely cause the increased depression and anxiety and
Yeah.
the other symptoms that I mentioned. So that was new,
That is
and
new.
not to say that you have to live in
But
Whitehorse and
yeah.
Yellowknife and places in the north to experience it in the summer. It's certainly possible. So it's important for everyone to know that, hey, if I have these fluctuations,
Hmm.
not for a day, but seasonal fluctuations at any point in the year, it could be seasonal
Hmm.
affective disorder. There's not something wrong with me.
Yeah.
These are things that are normal. 40% of people experience mental health conditions in their
Hmm.
life or more. So it's something that it's okay to have. There's help out there, and don't be afraid to ask for help.
I think that's exactly why we do stuff like this is just to communicate and know that like if you're struggling,
Yeah,
there's so much support. There's so, especially Kelowna too. We have such a good community. You never really truly have to be alone because there's so many people that even if you're a stranger or your pharmacist or whoever, you care that you
absolutely.
want people to feel good. um, I mean, we're humans. We want to feel the happiness all the time, but like you said, it is normal to fluctuate emotions throughout a day. But it's this dark,
Yeah.
dark, dark feeling that if you are struggling, like you said, it's not like people are purposely putting themselves in depression.
No, and it's nobody's fault that they're in that place. You're not worth anything less than any other person. There's nothing wrong with you. It's a medical condition that most
Hmm.
of us or many of us experience at some point. And so it's important to raise that awareness. I mean, this seasonal affective disorder
Hmm.
goes along with all mental health awareness. And it's important for us all, if we have the ability to raise awareness that this is normal, you're not alone. And if you're at the point where you're feeling something like this all the time, please come to us or come to someone and talk about it and try to get some help. Don't allow yourself to withdraw, which is
Yeah.
with many mental health conditions, including this one we're talking about, withdrawing away from normal social interaction is a
Mhm.
common thing. And it ends up making it worse usually when that's what
Yeah.
you do.
Yeah. Okay, well, I learned something new, like always. Anything else, or do you think we covered a good chunk of our seasonal?
I think we covered things pretty well. I mean, the big thing, yeah, is even if you don't suffer from seasonal affective disorder, vitamin D is a supplement we should all take in the
Yeah.
winter around here because it's so important for the immune health and so many things, our bones.
Hmm.
Um, you come to talk to us about vitamin D supplements, anything like that. If there's something that you're not feeling good about or you need help, please come to talk to us or another healthcare professional that you trust. We're just here to try to make people
Mhm.
better, make our community feel better, and hopefully be good medicine for everybody.
Mhm. Well, thank you, Stephen, for coming on again. And we'll be back next month with a new topic. And I hope everyone enjoys the rest of their January hibernation month, I'm calling it.
Yeah,
It's a good time to take some rest still, though, even though it is darker. But that doesn't mean you like go to the gym and all those healthy habits that we have talked about. I think each episode we really want people to just feel good. So
absolutely.
thanks again, and have a good afternoon.
Okay, thank you.